Well, welcome everybody. I'm going to go ahead and get started on time. I think we'll probably have a few more join us as we move along. I'm really excited to have this joint seminar between Gatton College of Business Economics and the College of Public Health, an issue that we all care a lot about. Today we're going to talk about strong social distancing measures in the US and that they reduce the COVID-19 growth rate. Our two presenters are Charles Courtemanche and Aaron Yelowitz. I will have a little bit more about them in just a second. And then I and my colleague James Ziliak will provide a little bit of discussion from both the public health and the economics point of view. Okay.
Teresa, you're muted.
A few housekeeping items. If you have any questions, please submit them using the Q&A feature on this Zoom platform. We plan to allocate 15 to 20 minutes at the end of this webinar for Q&A. If you have technical questions, please use the chat feature to submit any technical questions. All right, so our two presenters today, and I didn't print out my introductory slide, so I'm going to wing it. We have Dr. Charles Courtemanche, Chuck Courtemanche, who is an associate professor of health economics in the Gatton School, and also the director of the Institute for the Study of Free Enterprise. And I don't remember anything else, so we're going to move on to Aaron. Aaron Yelowitz is a professor of economics in the Gatton School, and he is the former director of the Institute for the Study of Free Enterprise. So two really awesome guys who know a lot about what they're going to talk about today. I just want to quickly show you us. Jim and I will provide some commentary. Jim is faculty in Gatton and several other director titles, and I am faculty in the College of Public Health. So without further ado, I'm going to stop sharing my screen so that Aaron can share his.
Teresa, can you give me a thumbs up if you can see my screen, just so that I can, that you can see the PowerPoint slides?
Yep.
Hi, everyone. I'm Aaron Yelowitz, and I'm one of the co-authors on this study. And so Chuck and I are going to split about 25 minutes of worth of time. So my phone will go off in about 12 minutes, indicating for me to hand it over to Chuck. What I'm going to do is try and give you a little bit of motivation for why we as economists are studying this issue. And from there, Chuck will transition into discussing our findings and as well talking about some of the policy implications. So around a month ago, we published a study called Strong Social Distancing Measures in the United States and its effect on growth rate of COVID-19. The study is forthcoming in Health Affairs, which is a fairly prominent journal in health policy. And what we wanted to do was, given the unusual nature of the times, and given that Zoom is actually very good for breaking down silos, where people from all across campus can actually join in a conversation, and given fundamentally the interdisciplinary nature of COVID-19, where there are some economists who are studying the issue, many people in public health or in medicine, of course, are intensely focused on this issue. We thought this might be a chance for us to try and talk to a larger group on campus and try and, in a sense, just communicate a little bit better. So the first thing is I want to introduce the people who are on our research team and give them the appropriate recognition. So Chuck and I are both professors, as Teresa said, at University of Kentucky. And in addition, one of our PhD students in the economics department, Lee, is also a participant in this project. As well, our colleague at University of Louisville, Professor Josh Pinkston, is part of our research team. And then as well, a graduate student at Georgia State University, Joey Garuccio, is the 5th member of our team. So probably the first thing we want to discuss in a setting like this where we have a broader group of people than we typically do in an economics seminar is try and just for a moment say, why are economists evaluating health effects of social distancing policies? We're not epidemiologists. All members of this research team are economists or PhD students in economics. And so it's a very good question. The answer is that these are the sorts of things that economists tend to do nowadays, which is evaluate policies, try and evaluate them convincingly, rule out alternative stories that might be going on, measure effects accurately, and then report them. So the sorts of evaluations that Chuck and I and the research team are doing with respect to COVID-19 are really no different than, for example, what Chuck and I did when we were studying the Affordable Care Act, or when there's a host of other policies that are going on. What we're not doing is studying, for example, the SIR models that epidemiologists study. We, of course, would like to interact with a larger group of people, and perhaps part of the motivation for today's webinar is for us to try and introduce ourselves to you and to encourage greater dialogue between you guys and between us. So hopefully that gives at least a little bit of motivation, which is economists tend to work with data. Economists tend to evaluate policies, and that's exactly what we're doing in this paper. It just happens to be with respect to a pandemic rather than, say, labor market effects or something like that. So the key question which we're asking, which is purely a positive question, an objective question, is did government impose social distancing measures bend the curve on COVID-19 cases? And one of the advantages that we have in this analysis is that we try and separate out several different policies to tease out which ones mattered and which ones didn't seem to matter. The underlying mechanism behind all of this is pretty much the following. Government policies in some way, shape, or form are meant to dampen human mobility during a pandemic. We think that some policies are perhaps more effective at doing that, and others may be less effective at doing that. From there, one imagines that human mobility has some relationship with virus transmission, which in turn shows up in terms of measured COVID-19 cases. So it's very possible that not all forms of human mobility have the same effect on virus transmission. And of course, there are structural issues in measuring COVID-19 cases. So these are all the sorts of things that in an empirical analysis like we do our best to account for. Another thing to say at this point is we are doing empirical work, and one of the approaches that Chuck, me, and the rest of the research team have is to not let the perfect be the enemy of the good, in the sense that there are a host of limitations in any empirical analysis. We're not doing a randomized controlled trial or anything like that. The data is far from perfect. However, given the importance of the policies at hand and the idea that we need to have a discussion now about these measures, not several years from now, then we felt it was appropriate to try and weigh in at this point. And of course, we'll continue to weigh in, and we'll try to make our models better, use better data. And if better data suggests different policy prescriptions, we certainly would do that. In terms of empirics, what we're going to do is we're going to look at a model, and Chuck will explain this far further, that basically tries to gauge the effects of different social distancing policies at different points in time. We're going to look across essentially all US counties, and we're going to have daily measurements on cases over March 1st through April 27th. We ended around April 27th because the first states were reopening around that point. The bottom line on what we find is that two of the measures, shelter-in-place orders and the closure of restaurants, restriction of entertainment, mattered significantly for the growth, for bending the curve, for reducing the growth of COVID-19 cases. On the other hand, there were two other measures, one of which, when we were talking about this a few weeks ago, there was intense interest in, which was the closing of public schools. The second, we didn't get that much attention on at the time, though I think it has, in a sense, swelled up lately because of all of the issues that are going on in the United States today about large gatherings. But we tend not to find effects of schools or large gatherings. And just to give you the answer on why we think that those may not have the impact that you might expect, is that when we were examining the data, there were opportunities to substitute towards other forms of human mobility. So rather than dampening human mobility, what we think is that those measures may have simply displaced human mobility. We go through some simulations and we come to some eye-popping numbers that in a sense are a natural consequence of not dampening exponential growth. Without the measures, unchecked growth could have led to 35 times as many cases. By the end of our period, there were about 1 million cases in the US, so you multiply that by 35 and you get a very big number. Now, Chuck will talk about our skepticism on would the model have continued in the way that it did, but basically we think that's hugely important. We don't simply want to dwell on the past, we want to talk about whether our model and our findings have implications moving forward. So obvious things that are huge sources of concern are how protests and super spreaders might potentially matter for COVID-19 and the disparities that might bring, the concerns about a second wave and whether effectiveness of policy will matter there, and then other policies that might be in play. Now, some people may think it's obvious that government-imposed measures actually bent the curve. So our findings might simply say, well, of course they bent the curve. Even if one expected lockdowns to reduce growth, the magnitudes are not necessarily clear. And what I do want to emphasize is that there is substantial pushback against the idea that the heavy-handed government-imposed measures bent the curve substantially more than what would have occurred under voluntary action. For example, there are prominent policymakers, some of which are with the Council of Economic Advisors, who question whether anything more than voluntary measures might be necessary. So I did a quick search, and for example, Tom Phillipson, who is the head of the Council of Economic Advisors, basically has tweeted out in various ways, arguing that voluntary measures were happening prior to stay-at-home orders. And the goal of our work is not to actually question that voluntary measures will matter. Chuck can explain why we're accounting for those things. But what the goal of our study is to do is ask the degree to which these more heavy-handed government-imposed measures bent the curve beyond what would have happened with the voluntary measures. We look at 4 measures: shelter-in-place orders, restrictions on restaurants and entertainment, bans on large gatherings, and closing of public schools. Our approach controls for other policies and trends that are nationally uniform. So to the extent that things like federal guidance on things like wearing masks, increasing knowledge or precaution, or travel bans, which essentially occur at a given point in time, our model will control for those sorts of things. Unfortunately, we can only look where the light is shining. The policy measures that we look at are easily documented. There are other policies that, such as wearing masks, strong encouragement, or even mandatory measures that are not modeled due to lack of data. We look at confirmed COVID-19 cases. We do that because, among other things, that's perhaps easier to measure than other things. There are many important outcomes that are beyond the scope of this particular study, but we think are clearly important, including fatalities and hospitalizations, excess mortality, which would include unmeasured COVID-19 cases, but also other consequences of the pandemic, economic outcomes, which are hugely important and not something that we address in this study. And then there's a vast array of other measures of well-being beyond economics and beyond health. We think that there are 4 policies that have the potential to either reduce or displace interactions with other people, which in turn affects virus transmission. The shelter-in-place orders, Chuck and I view that as strong state-imposed nudges to reduce interactions. Largely, although there may have been financial penalties on the books, they weren't enforced. So we view that as a very strong state-sponsored nudge. On the other hand, it's far more binding that the government could close restaurants and really, in a sense, enforce that. And there is some argument that there's some argument that people in close, dense quarters and restaurants can easily spread disease to each other. We've given some thought to why bans on large gatherings and school closures don't matter too much. And one natural question is, what happens in the absence of bans on large gatherings? Basically, if you ban large gatherings, perhaps people get together in smaller gatherings rather than not getting together at all. If you close public schools, it's possible that parents and children, in lieu of going to schools, might simply get together in other venues. And with that, I'm going to hand over control to Chuck, and I'll then mute myself. So let me stop sharing. And I believe Chuck should be able to take over from here, and then I'll mute myself.
All right. Can you see my screen? All right. All right. Thanks, Aaron. So yeah, so I'm just going to kind of get into the weeds a little bit more as far as the the details of the model and the econometrics, and then get into the results. So our econometric model is what we call an event study. And the idea behind an event study is that, it's very commonly used now in economics, other social science, a variety of settings when you don't have experimental random, variation to look at. And the idea is to trace out the impacts of a particular intervention, like a government policy, over time in a very fine-grained way, where what you're really looking for is, does the quote effect of the policy pop up at the right time to look like it's causal, as opposed to being driven by other trends that were happening and would have continued to happen even without the policy intervention. So that's really the primary econometric, empirical challenge here, teasing out causality from other stuff that was going on. And the event study model is a common way to get at that. So the basic idea, again, it's this very flexible tracing out of the timing of impacts with still, potentially control groups and so on. Although in this case, most states, most counties ended up with these measures after one point or another, with the exception of the stay-at-home orders, where several states never turned those on. So what's really driving our results is differential timing of the implementation of these measures. So two specific things the event study model does that are important in terms of the credibility of the results. The first one is it's allowing for this gradual nature of the timing of the impact. So if you think about these social distancing restrictions, these policy interventions, the different elements of the shutdowns, right? You would not expect to see a spike in cases the next day. That would be sort of implausible, really, right? If you close schools, let's say, or you close whatever sector of the economy, implement the strong advisory to stay at home. Let's say people's behavior changes the next day, which there could be a lag there too, but let's say behavior changes the next day. Well, maybe infections are occurring at or around that time, but there's going to be a lag, the incubation period before someone gets symptomatic. There's going to be a delay in seeking medical care, another delay in terms of getting a test and then waiting on the results of that test, and then possibly another delay where that the test result is making its way to the state's database or their records. So you add it all up and you really expect even a policy intervention that's quote working in terms of flattening the curve, you're going to be expecting that to sort of emerge a little bit more gradually. So the event study model allows for that. Specifically, we bracket the timing in 5-day bins. If you go too narrow, the precision becomes a problem. 5-day bins seem to strike the appropriate balance in terms of precision, and also allowing precision in terms of small enough standard errors, and then also allowing some flexibility in the timing. So we're using these 5-day bins. So first 5 days after impact, days 6, or after the intervention, days 6 to 10, days 11 to 15, etc. And then at the end, we have the 21 days or more is this catch-all, in the back end. And importantly, we have 20 days post-intervention or more for every single policy that happened. So we have this geographic balance, this apples to apples comparison up to that 20-day mark. Okay, so flexibility for gradual effects. The second really important thing the event study model does is it allows us to look at quote unquote effects even before the policy occurred. Okay, so these are placebo effects. We should not be getting effects there, right? The policy hasn't happened yet. Restaurants hadn't been closed yet, etc. So if what we're getting is truly a causal impact of the policy, you should not pick up quote effects prior to the policy actually being implemented. So that's an important kind of placebo check to try to tease out, is it really the causal effect of the intervention, the policy intervention, or is it just, people stopped going to restaurants anyway, just based on what they were hearing in the news? So that's an important step to kind of disentangle those two. Okay, so so it's an econometric setting where then on top of that flexible timing of the policies, you also have these control variables for day testing, the growth. We want to control for differential access to testing across places and how that evolved over time. We're controlling then for geography and for time and for testing. And we're allowing the underlying time trend, the underlying trajectories in the absence of policies to differ by census division, right? Because we realize outbreaks were seeded in different parts of the country at different times, right? So then let's dig into the results. So we're going to go one variable at a time, but it's important that they're all in the same model together, right? We're just showing them one slide at a time. So the shelter in place order first. The dot with no bars is the reference period, right? So you're anchoring in the 5 days prior to intervention, you're anchoring that at no effect. Like that's so all the other things are compared to the 5 days right before implementation. So then the dots show the evolution both before and after the policy took effect. The bars are these 95% confidence intervals. So you can look at that as saying we're reasonably confident that the quote true effect lies somewhere within those bars. Okay, so what you're looking for in terms of statistical significance is the bars not to cross zero, because that means we're fairly confident the effect is different than zero. So the pre-trend, it may be a little upward pre-trend, which would be suggesting, if you kind of traced that out, that would be suggesting that that shelter-in-place orders came online faster in places where the outbreak was spreading faster. But again, they're statistically insignificant. We shouldn't read too much into that. Basically, if anything, that means our results might be a little in the conservative direction. So then what we see for these shelter-in-place orders is the exact sort of timing that we might expect. Not much right away. You start to get a little more, you get statistical significance in that, this means 6 to 10 day window. Then a little bigger, a little bigger, a little bigger. So this gradual effect that's sort of growing over time out to this 3-week mark. And if we were to interpret that point estimate, that's telling us about an 8 percentage point reduction in the growth, in the daily growth rate of cases as a result of these shelter-in-place orders. So what that is, so think of it this way. Our data tell us that in the absence of any sort of policy interventions, in other words, still with voluntary social distancing, still people responding just from what they're hearing, the guidelines from CDC and so on. With all of that still, but without any government imposed restrictions, we find the underlying daily growth rate was about 16% per day. A pretty rapid spread, underlying spread. This tells us about an 8 percentage point reduction in that growth rate from shelter-in-place orders. So that's telling us, you can think of it in terms of, instead of a 16% daily growth rate with a SIPO, shelter-in-place order in place, we're at 8%. So you can kind of loosely speaking think of it that way. Restaurants and entertainment centers, so the closure of these facilities seems to level off at roughly a 5 percentage point or so impact. An interesting thing here is you don't really see that same emergence gradually. You see a little bit even popping out, you know, it's even still slightly statistically significant there, even just in the 5 days after. One thing to highlight is the standard error bars are fairly large there. So, you know, we shouldn't put too much stock maybe on just one, you know, on one dot, but the overall pattern of results, and it's also borne out by 1 million robustness checks we did that are buried in the online supplemental appendix of the paper, is, you know, we kept consistently seeing numbers around a 5% percentage point or so from these closures of these entertainment related businesses. Then the other two, as Aaron said, we really don't find any evidence of anything. So here's the ban on large gatherings. An important thing to emphasize, there's really, you know, first thing to point out, of course, nothing, even if you took the confidence intervals away, even the dots are just not much going on there in terms of the point estimates. Now, what does this mean and what does it not mean? So first thing, we're modeling it as a ban on gatherings of 500 or more people. We're basically modeling it as the first ban on large gatherings imposed by the state or county. Most of these, it's almost closer to the truth to say this is a ban on gatherings 50 plus, because those 90% of the time, these bans went all the way down to 50 people. So important caveats. One, there is what appears to be a little bit of a pre-trend. Now it's dangerous to really try to project that too literally, but if that is a real literal pre-trend, then the ban is kind of fighting against that pre-trend. So that could push us toward not finding anything, maybe. At the same time, what you also, the caveat we should also point out here is that this is the effect or lack of an effect of the state or local government action to stop the specific prohibition, okay? These prohibitions in almost all cases came on board after the biggest events were already voluntarily being shut down. March Madness had already been canceled. The NBA, the NHL had already stopped doing their events. So it could be the case simply that these bans were just redundant because the biggest, you know, most likely super spreader type events were happening anyway. So what you should not do is take this result or lack of a result and say, let's just open up Rupp Arena and let's all start, you know, 30,000 people gatherings again, right? That would not, that'd be far out of sample essentially. Even more interesting is this public school closures. And again, just nothing in terms of, you know, statistical evidence of any impacts. In fact, if anything, if you just take these dots literally, it almost looks like closing public schools was making it a little worse. Now, we got to point out the confidence intervals again are big. So really and truly, in the most conservative way, what we're saying is closing the public schools did not reduce the growth rate by more than 5 percentage points, right? If you want to be very conservative. The other important caveat with this result to point out is you got to think about where the identifying variation in the data is coming from. So in this case, it's all coming from, you know, all the schools in the country basically were closed within 10 days or so of each other, really in most cases within a week of each other. Okay, so what we're really saying here is that there's no discernible evidence that closing that places that closed the 1 week earlier than the other places, you know, got any tangible benefit from that. That's way different, of course, from saying, well, it's just, you know, if schools are open for 4 months, You know, very risky to take a result like this and go that far out of sample. But this is, so how would I take this in terms of moving forward and thinking about schools in the fall? Well, first of all, you know, Aaron and I, and probably some are very interested in studying this further and trying to nail that down better, and we plan to do so. But I think what you take something like this as just highlighting needs more investigation, right? It's kind of putting it on the radar and drill into more. Don't just assume that closing the schools is going to make this massive difference without supporting evidence. And we all know Aaron talked about the story where, you know, if you close the schools but nothing else is closed, are they just congregating at parks or people's houses? Daycare facilities were still open in most cases there. That's a possible story. You know, there's also this growing debate about just how affected kids are by COVID-19, and that's out of our wheelhouse, you know, quite a bit out of our wheelhouse to comment on that, other than to just say it's an ongoing debate, you know, among scientists. And so a result like this just maybe puts a little more emphasis on that debate too. So then if you add it all together, and I'll close in just a couple of minutes. If we add this all together, the combined estimated effects of all four measures, you have this gradual ramp up that eventually hits up to 12 percentage points. So again, think of that in terms of, instead of a 16% daily growth rate in cases, talking a 4%. So the flattening the curve in that regard, quite successful. The last thing we do, and there's caveats all over the place when you try to get to specific numbers here, but we try to ask the question: if state and local governments had not done any of these things, and we'd instead relied purely on voluntary social distancing in response, say, to CDC guidelines or recommendations, sort of a softer approach, what would have happened, this counterfactual scenario? And we find that by the end, roughly the end of April, we'd have had 35 times more cases. And again, that's taking the estimated effect on daily growth rate and projecting that outward. So, you get a little bit out of sample there in terms of where the variation is. And, I would caution against taking that 35 times number extremely literally. General point is it's big, right? When you take this difference in growth rates from day to day and you compound it day after day after day, it can add up to be a pretty enormous difference. So we're not talking about, we would have had twice as many cases. We're talking about an order of magnitude. And then this just depicts that visually. The restrictions, this is the natural log scale, right? So in levels, this is actually quite a bit bigger of a difference. So the restrictions started to come on board right in here, about the 10th of March. And then they gradually rolled out. First week of April was kind of when the last restrictions were put in place. So the interesting thing to note here is you would not know that you missed it in this range, right? A state that started turning stuff on here versus one that started turning stuff on here, snapshot in time here, end of March, the one state doesn't think it did worse than the other one, right? There's not really this tangible difference, but it's the exponential growth over time that leads you to this enormous difference. And when you think about reopening, there's a clear link there where if it was going to be a problem, you wouldn't see it until I like to say that you don't see the boulder rolling downhill until it's too late to stop it. And that's kind of the lesson in there. The gaps emerging much more gradually. So we've got a ton of ongoing projects trying to build on this more. We're happy to get into any of this in the Q&A. The basic idea, though, that I'll wrap up with is moving forward, you don't want to go too far the other way and say, well, these results are pretty provocative. That means we've got to keep shelter-in-place orders in place all the way until a vaccine. I mean, you have to acknowledge, and we're economists, we have to acknowledge the collateral damage is enormous. Moving forward, the idea and the challenge is, if what we're saying is light measures didn't work, strong measures did, can we find intermediate measures where you get most of the public health benefit and you don't wreck the economy at the same time? And that's where there's this laboratory ongoing with the various aspects of reopening and how we can do that safely. And that's where, you know, people with our skill set are interested in continuing to examine moving forward and kind of helping guide that in any way we can. So with that, I'll wrap up and we'll open it up.
So actually, at this point, Jim and I are going to offer a little bit of discussion, and then we'll open it up for questions, probably by about 1:45. So let me share my screen for a second, please. Can folks see this? All right. So I want to spend just a minute talking about the public health implications of the study. I was having trouble with that. Okay. So I want to make two major points. One is we desperately need good information on what social distancing measures work, what their relative impact is, and what their relative speed is. I clipped out a piece from one of the relatively widely used epi prediction models, and where you can plug in certain stuff about your local market. And in this case, you also plug in information on, you know, did your state implement school closures, large gathering bans? What's the date? And you actually say, okay, what do I expect this impact will have on the reproductive rate, which is the epi version of a growth. Yeah, it's the growth rate. And so we are simply, we're using guesstimates to think about the impact of particular social distancing measures in the current epi models. We need much better data. In fact, a lot of our guesstimates are working on what happened with the social distancing measures associated with the 1918 flu. So, and then obviously the early information from Wuhan and Italy. So my point is, we need this work, we need more of this work. And just a point about thinking about future work or further work in this area, I think we're gonna have to start adding additional complexity. So for example, the study from Chuck and Aaron et al. Was really in the absence of testing, a lot of testing or contact tracing. And as these come online, what is the interactive effect of this on the effectiveness of these other measures? I think that's going to be important to tease out. I think also that we know that virus spread, adherence to social distancing measures on a voluntary basis, testing and tracing, it's going to be a story that is below the state level. It's going to be at the city, county, or sub-state regional level. And so how do we capture this different levels of variation to further refine the estimates of impact? So those are my quick comments. I'm very excited about this paper, and I'm going to quit sharing my screen so that my colleague, Jim, can share his. He's going to talk a little bit about the economic implications.
Great, thanks so much, Teresa. And thank you all for joining us this afternoon. The presentation by Aaron and Chuck and their collaborators, it's a really nice piece of economic analysis. I encourage you to go online. You can take a look at the ahead of print version on the website at Health Affairs. Their paper has received a tremendous amount of attention in the national media, New York Times, Washington Post, television, CNN, multiple CNN stations, Univision. So it's clear that the economic analysis that they presented to you this afternoon, has really had an impact on kind of the wider discussion on the impact of some of these social distancing measures. We're all living it. And so we all, I think are actively engaged in trying to understand, some of these implications. And I really applaud Aaron and Chuck and their co-authors on their work. What I want to do is just kind of put a couple of financial numbers attached to the social distancing estimates that they provide. And so in economics, a standard way that we monetize the mortality risk reductions of any public policy is what we call the value of statistical life. And what it does, it represents the money risk trade-off of a small change in risk. And typically these estimates of the VSL are based on estimates of additional earnings a worker receives in response to increased risk of fatal injury on the job. I actually collaborated with Kip Viscusi at Vanderbilt University, who's known as perhaps the world leader in work on the value of statistical life. Some work with Kip Viscusi, Tom Kniesner at Claremont Graduate School, and also Chris Woke, who was a PhD student in economics at UK back in the aughts. And so we have a series of papers looking at the value of statistical life using data in the United States. We came down, our last paper on that was published in 2012, and we had a range of estimates that went from $4 million per statistical life saved to up to $10 million. The modal estimate today, using more recent data, and if you inflate the values from our estimates, puts it closer to about $10 million. And that's the government, that's the estimate that's used by the Environmental Protection Agency and other federal agencies in estimating the money risk trade-off associated with various public policies, whether it's regarding airbags on vehicles or scrubbers and pollution mitigation efforts, or in the case applied here with social distancing associated with COVID-19. So we have this modal estimate in the US of about $10 million is the value of statistical life. So if you take the estimates presented by Aaron and Chuck, that in the absence of any social distancing measures, roughly 35 million Americans would have been infected by COVID-19 by the end of April. To date, the estimated case fatality rate in the US, now this is the number of fatalities relative to the number of confirmed cases. The case fatality rate in the United States is 5.8%. So if you take the number of potential infections of 35 million, and you say, well, let's just assume that the case fatality rate would have been 5.8%. That means social distancing through the month of April potentially averted 2 million fatalities. This means the implied value of statistical life is about $20 trillion, or 93% of the total US GDP in 2019. Even if you used the Kniesner-Viscusi-Woke Ziliak lower bound estimate of 4 million, then this averted loss amounts to about $8 trillion. And so the bottom line is that, social distancing passed any reasonable cost benefit test. Now, Chuck and Aaron were very careful at the end to say this doesn't mean it would pass the test on infinity until a vaccine is found, because we don't know, right, how long it's going to take to find a vaccine. And we don't necessarily expect the infection rate to grow at a similar rate going forward than what it was in the initial days. So, but that said, we have averted potentially a massive economic loss, right, in terms of fatal life. Now, some people say, yeah, but the people who are most likely to get infected are elderly, those who have potentially very few years of life left and things like that. So there is an alternative calculation of value of statistical life of years saved. And so if you just take these estimates of $10 million and the 2 million averted lives, and you take the annual present discounted value, you're still going to get potential savings of about $1 trillion. Okay, even if everybody saved was only going to live one additional year. Okay, so we averted death 1 year early. Right now, obviously, that's a gross overestimate of shortness of life for the people who have been affected by COVID-19. And so I'm not necessarily advocating that use, but it's an incredibly conservative use of the VSL. And even still, we're talking $1 trillion potentially averted. Okay. Now, obviously, a real challenge with this entire social distancing is that we've shut down the US economy. And households, a typical household in the US, and firms as well, are highly liquidity constrained. They don't have enough cash on hand to be able to avoid potential economic disaster in the short run. And therefore, they're not really in a position to bear the cost of the loss of economic activity, at least in the short run. So in the United States, there's been robust monetary policy changes by the Federal Reserve Board, as well as a number of fiscal policy changes by Congress to try to mitigate some of this economic loss to families and firms and state and local governments. That said, I think most economists would agree that the amount of effort given towards the mitigation of these losses is not adequate enough, especially on the household and state and local sides of the ledger. So for example, the federal safety net response to the 2009 Great Recession was more robust than the response today to the COVID-19 crisis, even though this current crisis where we're now have 40 million people claiming unemployment insurance swamps the economic loss associated with the 2009 recession. So I think many of us believe that it's not a matter of if, but when Congress will need to act again to pass something like a CARES 2 to address this ongoing hardship facing families and firms and state and local governments. So I think with that, I'll stop and then we can open up to Q&A.
Thanks so much, Jim. I'm going to turn to my colleagues, Elliot and Allison, to see if, I don't see that we have any questions.
So it looks like we don't have any questions yet in the Q&A.
Okay.
But want to make sure everyone knows where that is. The box should be at the lower part of your Zoom screen. We do have a thank you coming in through the comments box. So thank you all.
I have a question in the chat, so I'm going to read it and then I'll invite colleagues to comment. It's from Vicki Davis. What is the percentage of working remote? So are you saying how many folks are, okay, yes, do folks understand that question? Looks like I've got both Jim and Aaron unmuted, so maybe one of you can respond.
Well, first, I'll feign ignorance about the actual number. I know that there's a widely cited paper that is posted on one of University of Chicago's websites, the Becker-Friedman Institute, that basically breaks down the kinds of jobs that can be done well remotely and basically on a county-by-county basis, I think, how many people are able to, in a sense, comfortably shift. So rather than giving an answer, I'll provide a source, and there are people who have very carefully measured those sorts of things.
Yeah, I don't have, that's a great question. I don't have the point estimate on how many do, but you could do a little bit of a back of the envelope calculation on something like that. And that most jobs in America that kind of facilitate work from home oftentimes entail those people with some college education or more. So people with a high school degree or less are more likely to not have access to jobs that offer work from home. Now, obviously, there are exceptions to all of those rules, but roughly about half of adults age 25 and older have some college or more. Now, if you break that down to 25 to 55-year-olds, kind of what we call oftentimes as a labor economist, a prime age working group, that fraction who have a 4-year college degree, which is the population most likely to have access to work from home jobs, that's roughly about 35% of the 25, almost 40% of the 25 to 55-year-olds. Okay, so that gives you some kind of rough estimate of the fraction of people that might have access to those types of jobs. But there's a decent share of that population who currently are out of work. Okay, even though they potentially could be working from home.
Great.
Yeah. And Teresa,
I think I've got a bunch more questions.
all
so
right, we can move on.
But feel free to follow up with the speakers if you want more details. So the first question I got is, can you comment a little bit more on the reopening and the risks associated with reopening?
Yes, I'll jump in on that one then. The answer, can you comment more? Sure. How confident am I in those comments? There's a lot of unknowns, right? The one thing you can really take from our results as it applies to the reopening, and I use this terminology that realize that we are playing with fire. I mean, that's the way I would put it. Did I cut out there?
Yes, you did.
Okay, so the one thing I would say here is realize we are playing with fire with the reopening. Whether you want to take our exact numbers and project them out, Teresa gave some reasons you shouldn't do that. I mean, now we have a lot more awareness about things like masks. We have better access to tests, potentially better ability to contact trace. No, you should not take our estimates and take them super literally and project, outward months into the future going in the other direction, right? But the one thing our results illustrate is that there's real risk here. I mean, if we had found that, okay, potentially the case toll would have been twice as large without these measures, then you can have reasonable arguments about, well, look, maybe we just open it back up and we accept it's going to be a little bit higher. We're doing that these implicit trade-offs Jim talked about, so it's important just to know, without putting too much exactly on a 35 million number, it's just important to know, is it big or little, right? And what we're saying is, no, this really is a serious thing. It really could have been a lot worse if we hadn't done all of this, and we got to be careful moving forward. I mean, and so what does that look like? So we got to be careful moving forward, and also cognizant of how delayed these impacts can be, right? I mean, that the slide I showed where we put it, put the graph and really showed that, it takes 2 to 3 weeks before the counterfactual scenario really starts to diverge in a huge way from what actually happened. So what I don't like hearing is the sort of thing where it's like, oh, Georgia reopened on April 24th and they haven't spiked. It's like, well, even if they did reopen all the way on April 24th, which then you got to talk 2, 3, 4 weeks. And B, they didn't reopen on April 24th. They reopened a couple of things, and still most people were staying away on their own. and then they reopened a couple more things a few days later. And then even if you just say restaurants are open, that doesn't mean people are coming back. If they think your state's opening prematurely, then their voluntary behavior is going to be different. So it's just this idea that we should not pass judgment on what the reopening is doing until there's quite a bit of time. I mean, at least a month, probably another,
Yep.
We're probably just now at the point when we can even credibly begin thinking about measuring these impacts.
If I can chime in, Chuck,
Yeah,
for just 1 second. I'll also mention Chuck and I, along with some of our colleagues at Indiana University, are looking at these sorts of issues right now. The issues that Chuck so well spoke about causal inference, are actually even more challenging with respect to reopening, because reopening tends to be triggered by declining trajectories in cases.
It's kind
So we don't need to dive into that in a 60-minute webinar, but learning the answers to these questions and answering them responsibly, and not necessarily being the first paper to market, but being correct, I think are all serious challenges in the research environment that we're in right now.
And Teresa, let me just jump in one more quick point. I'll do one more bad metaphor. Okay. If you are playing with fire and you know that you're not going to see the effects of what you did for 2, 3, 4 weeks, I think what that really argues for is the staggered reopening. I mean, and then the bad metaphor is if you're opening the door to a dark room that could be really dangerous, or it could be fine, or somewhere in between, you don't just throw the door open and race in and hope. You're creepy, one little inch, peek around, wait and see if anything happens, then another little inch. You know, so I really think in the most practical thing I can say is that it argues for this staggered, gradual reopening where you do a step, you wait a couple weeks, you see what, if anything, that step did, then you maybe, you know, nudge the door open a little bit more. And I will say, I mean, you know, Kentucky and lots of other states are at least trying to do that. And, you know, something like that staggered approach is, now how exactly to get that right is a whole different question. But
So I'm going to raise another question that's come in our chat feature, asking about thinking about a no restrictions environment like Sweden. We've all heard about Sweden. So what's actually happening to the replication rate, and why is it kind of unclear as to them not being as wildly unsuccessful as some of us thought?
Teresa, you may know their exact replication rate better than we do.
I don't. I apologize. I'm also an economist who works in the School of Public Health.
One thing I'll say to that is early in the pandemic, there were many cross-country comparisons, and one of the real issues is just differences across countries, differences in underlying health, and this past week has dramatically illustrated that there are disparities within the US that are perhaps fundamentally different than in other countries. You know, I think Sweden is an interesting test case. At least the kind of pop literature that I've read, I've been most convinced when they've compared Sweden to other Scandinavian countries. And when comparing it to countries that are much different, like the US or other parts of Europe, then I start to basically feel the same sort of pushback when people want to compare New York State or New York City to North Dakota. Basically, our analysis tries to deal with that, but basically, you know, the cross-country comparisons, I think, are one real contribution of what we do, which is to try and net out those kinds of differences.
And there's also the gradual nature impacts is important here too. I mean, I do think there were a lot of people yelling way too early that Sweden was a success. I read an article yesterday, I don't remember the source off the top of my head, but it was saying that last week, Sweden's death rate per capita was the highest in the world, you know, past us. I mean, we don't know what's going on in Brazil, but exactly, but, you know, certainly past us. And, you know, so jury's still out a little there. Second is population density is a real factor. I mean, we didn't really break things out separately that way. I will say we did a separate study focused more on just Kentucky and found instead of 35 times, that number we estimated was 10 times. And, you know, and that wasn't because Kentucky was late with the restrictions compared to other states. It's a different makeup of the population. You don't have the huge population centers, the very dense living. And Sweden is relatively more rural than a lot of other places, less dense, more spread out. Third thing would just be that the false, I think, dichotomy. Sweden is not the complete counterfactual situation of do nothing. Okay, they did close down large events. They did keep schools open, they kept other things open, but they did put in guidelines with those that, you know, are in some ways a little like the things we're moving toward now in terms of the reopening. So Sweden is not a zero treatment. Maybe it's a half treatment if you want to think of it that way, right? So it's not a true like control group. And there's also this issue of compliance, right? And the counterfactual is not a world where we just live like robots and ignore everything. It's a world where we have information, we have recommendations, and we just, you know, are allowed to make our own decisions subject to those. And, you know, compliance, relatively good in Sweden, I think, compared to what you might get in some other places. And so there is an argument that just providing that guidance, but not necessarily having restrictions, might work better some places than others. So all of that is in there.
All right, y'all, we got a lot more questions.
Oh.
And unfortunately, many of us also have 1 o'clock meetings. Dr. Ziliak's already jumped off. I'm going to encourage those who didn't get their questions answered to submit them to one of us. We are all in the UK directory. If you don't have access to that directory, please feel free to reach out to me, teresa.waters@uky.edu. With that, I want to thank everybody. This was just a tremendous discussion. I knew we would run out of time. I knew it would be too exciting, but I thank you all for joining and hope to catch up with you again in another session.
And Aaron and I are happy to
Teresa.
connect with anyone.
Thank you, Teresa, for facilitating this.
Yes, thank you.
Fantastic. Thanks, guys, for doing the yeoman's work. Bye, everybody.